Good afternoon, ladies and gentlemen. Welcome to this new segment of Medcast. We are pleased to have Dr. Mohammad AlJazea, who is specialized in pediatric medicine and especially in the respiratory illnesses. Welcome, Dr. Mohammad.
Thank you very much for having me here today.
Dr. Mohammad, we are so pleased to have you again here, and we need to discuss one of the most important diseases we have in the community now. The question is, what are the most common respiratory illnesses we have?
So in Kuwait, or global, let's say, viral illness is one of the most common respiratory diseases all over the world. And asthma is one of the also common and very common in Kuwait.
Mhm.
We have also COPD in older people. We have chest infections, some airway problems like tracheitis or bronchitis. But let's say asthma, you will see it all over the year. It's not seasonal, and we see it almost every day in the
Mhm.
clinic.
So let's say if we divide them like into two categories, the asthma would be the most common chronic illness we have for the children compared to
Yes,
the viral ones.
I do agree.
Yeah.
Yes.
So with the asthma, is it easy to be diagnosed from the first time they bring the child to check it up to check him up?
So, asthma, it's a challenge to diagnose it in a very early age,
Hmm.
below 2 years of age, because the symptoms are very similar to the respiratory illnesses. They come with wheeze, with loud breathing, difficulty breathing, a cough that is productive or wet, let's say, with a lot of phlegm.
Hmm.
But in older children, it's easier because you have a big history
Yeah.
where you see the children exposed to different triggers other than the viral triggers. Let's say a child who is a 5 or 6 years old, and whenever there is a sandstorm,
Hmm.
he would have cough, difficulty breathing. So that's a trigger that maybe a 6 or 7 months old child wouldn't be exposed to
Yeah.
in the winter time,
Yeah.
and vice versa. So it's challenging in very young children and fairly easy to diagnose in older children.
So do you believe the advancement in the medical technology now, using the new medical devices, helped to diagnose the asthma very
Yes,
earlier?
yes,
Yeah.
yes. Now we do have something called the pulmonary function test.
Yeah.
And now it's a portable, as big as your iPad or
No,
laptop.
it's very small now. Yeah.
Yes, and you can use it to diagnose asthma, or
Hmm.
let's say obstructive and restrictive lung disease. Obstructive, which means there is an obstruction in your airways because of some muscle spasm, and the air wouldn't flow smoothly through
Inside the
your
lungs.
airways. And restrictive, where the lung itself is restricted and does not expand normally,
Hmm.
so it will give you the difference between obstructive or restrictive, and obstructive mainly would be asthma.
Hmm.
So you do the test first, and then you give him Ventolin
Hmm.
or beta 2 agonist,
Agonist or
salbutamol,
salbutamol. Yeah.
and if he responds, then that's asthma.
So if he will respond rapidly at the time of the testings,
Yes,
and then
within
we
10
make the
minutes,
PFT.
you will see the change
Yeah.
with the PFT, then that's most probably
Okay.
asthma.
To give a clear advice to the parents, from which age you expect these symptoms might arise on the children to know or to take the child to the hospital.
So, as we say, these symptoms are similar to viral illnesses in younger
Hmm.
children. Uh, so, taking the child to the hospital is not because of the cough, not because of the fever, but if these symptoms are causing him to have a difficult breathing
Hmm.
or difficult to have his normal routine done daily, is limiting his activities. He cannot eat, he cannot sleep, he's getting tired, worse and worse. Then you take him to the hospital.
Hmm.
But some other coughs or fevers that can be treated at home, then you shouldn't take the child if you know how to treat the child. And especially parents of asthmatic children,
Yeah.
they have the history for a long time. They know when to use the salbutamol, they know when to use the steroids, they know they to use the inhalers or the spacers or the nebulizers. But in the younger age, with the newly married parents, then whenever you have any doubt that your child is having cough or difficulty breathing, or you're worried about him, you should take him to the hospital.
Now, I know I'm emphasizing on this question a little bit because some parents might think children under 6 months old might not have asthma. Will we accept these age group might have asthma?
So now, why we cannot point them at
Mm.
asthma? Because these children, they would have one or two episodes within this 6 months,
Hmm.
and because of a certain trigger, and we don't have enough history to say that this child is asthmatic.
Hmm.
So you need, let's say, at least 2 years to point this child as an asthmatic with a genetic factor, let's say father or mother or one of their
Family
relatives is
history.
asthmatic.
Yeah.
And during these 2 years, you review his history and you see what triggers these symptoms.
Hmm.
If it's only viral illnesses,
Then you would not consider him.
most probably wouldn't, because bronchiolitis, because of viruses,
Yeah.
would have the same symptoms.
Mm.
But if a child is 3 or 4 years old and he has been exposed to many triggers, then you can point him as asthma. So I wouldn't be pointing a child to 6 months with asthma from one or two episodes of
Okay, that's right.
respiratory
If
illnesses.
if the child is within the age group of a child attending a school, which
Yeah,
is like normally between 6 to, let's say, 14 or 15,
yes.
what advices would you give to that child so he can be cautious with the asthma symptoms, especially when he becomes away from his parents?
If he is asthmatic,
If he's asthmatic, yeah.
uh,
لا ما اقصد في actually الوقت.
okay. If he's asthmatic,
Yeah.
then you have to teach the child
Mm-hmm.
how to use his medication.
Mm-hmm.
And now we have the spacer, which is a portable thing,
Yeah.
doesn't need any electricity, and it's very small, and you can attach your inhaler to it.
Mhm.
And you teach him how to use it, when to use it, and what are the feelings that he would expect that
If he's
will
as a
tell him that he
yeah.
has to have to use it, okay?
Mm.
And some other advice we give to the children, if he's an asthmatic and he is not well controlled,
Mhm.
then we recommend at the beginning to take this medication or the inhalers before any sport activities. If he's a PE class and he knows that he will have the class within 10 minutes, then he will take it. Then he will have his class normally. During the class, if he's having difficulty breathing, he has chest pain, if he is not able to continue the class, he would advise him to rest,
Mhm.
to catch his breath, take his medication, and wouldn't continue for the rest of the class. So these are the advices that we would give for children with asthmatic.
And do you normally advise the parents to inform the teachers in the school?
Yes. Yes, I would recommend that every parent to keep a spacer and a Ventolin inhaler in the house, in the nursery or in the school, with the nurse, with the school nurse, and uh, his teachers has to be aware that this child is asthmatic, and they would help him whenever he has symptoms of or difficulty breathing.
Okay, that's great. Now, when a parent is having an asthmatic child, they think that the inhalers, all inhalers are the same, which we normally call the gray inhaler, and we have the other, which is the orange, and also the purple one.
Yes,
Now,
yes.
I know we have the preventive inhalers, and there are another inhalers that is used for the long term for treating asthma on a regular basis rather
Mm,
than just using
mm,
them in
mm,
emergency.
mm,
Could you
mm.
explain, please, the differences between the
Yes,
inhalers?
so the treatment of asthma, it's we treat it in two ways. We have the relievers,
Yeah,
the Ventolin, the gray or the
the
greenish
green or
one,
the gray one. Yeah.
and this used to have an immediate relief of symptoms
Hmm.
within 10 minutes. But we have something else called the prophylactic or protection inhalers that is given in a daily basis for long term, 2 to 6 months, under the supervision of your doctor.
Hmm.
And these inhalers are given to protect the children to minimize the symptoms and to have a better lifestyle for the, and we have plenty of them, maybe six or seven.
Yeah, which is like a mixture between a corticosteroid and beta agonist as well.
Yes,
Now, the question is, I know the journey of treating asthma is like stepping upwards in the treatments.
yes.
Some people think that if they go upwards in the second or the third step of the treatments, they cannot go back with the progress, let's say, of the disease. Is that right?
No, 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 no. It's actually a stepwise, as you said. It's a step up and step down in the treatment. So children, he might step one or two steps above or high, and if you see the symptoms are controlled within, let's say, 6 weeks,
Mhm.
you can challenge the child, remove one part
Of
of
the
the
medications.
medication, and you see the response. And in younger children, I would say we have a high percentage of children would be without the medication if they have a regular follow-up with their doctors taking their medication. So we have a good chance of taking away their medication if they are well controlled and they have a symptom-free period, let's say 4 to 6 months, then I would be happy to remove it slowly and gradually.
Okay.
And whenever he has the symptoms, we can always go
Go
back.
back to the medication.
Yes.
The last question of this episode will be that I feel that when you were talking about the asthma, you were so emotional. Why you are so
Yes.
interested in talking
Yes.
or discussing asthma?
Yes. So I am asthmatic myself.
So that's the
And
reason.
yes, that's one of the
Mm,
reasons I choose to be a respiratory specialist.
mm.
So my father, God bless him, he was
God
taking
bless
us to Benzina, I think, one of the hospitals years ago, in the 92, 93, where I was asthmatic.
you.
So I needed to be going to the clinic every 2 to 3 months to have a regular follow-up with our doctors. And back then, we didn't have these options of prophylactic
Medications.
treatment or
Yeah.
medications, and we are using oral Ventolin that doesn't have any
Taste.
effect. And oh my God, now with one puff, within 10 seconds, you feel relieved.
Yeah.
Before, you have to wait maybe 2 or 3 hours, and you wouldn't have that immediate relief, and you would struggle. But now it's very easy,
There's
to
a
be
very
honest
big
with you.
change
It is a
in the
very big
medical
change.
technology, let's say. Dr. Muhammad, we are so pleased to have you, and it was a very good end of this episode, like mentioning your story and your experience as an asthmatic patient. So thank you again to have you, and we hopefully we have you again.
Thank you very much for having me. God bless you, and I hope that your audience will be happy with our
Thank you, sir.
episodes.
Thank
Thank
you
you.
so much. Our dear viewers, we have reached to the end of this segment of Medcast. Hopefully, we can see you again with a new healthcare specialist. Until that time, goodbye.